Hi, my name is Vicky Rodriguez and I'm a critical nurse specialist and team leader for County Hackney. Okay, so what our presentation is about how do we engage hard to reach young people, and some of the initial issues were that there was a gap in services was identified. So from a CAMS perspective, we had really good take-up with smaller young people and their parents, but from the ages of around 14, they would either attend and disengage quite quickly, so we might pick them up through the self-harm referral at Homerton Hospital, and they would have an initial assessment and then they wouldn't come back. And also in terms of the youth offending population, we only had one CAMS clinician in the youth offending team, and what we recognised was there was a greater need really, and we weren't really addressing that. So the solution, that's the gap, was that the local authority funded a specialist CAMS team to work in partnership with the youth services,
So CAMS for Young Hackney works can sit within Young Hackney. Young Hackney is an integrated youth service, so it's an amalgamation of what was the old youth offending teams, targeted youth support and general youth provision. And there's a focus both on early intervention and prevention. And basically, Young Hackney work with any young person within Hackney, and then offer targeted support specifically to those who need it. There's multi-agency referral route through the partnership panel. So this is a panel that sits every week. It has education, social care, CAMS, Young Hackney, police, housing.
and all of the core leaders, and all the network in Young Hackney.
We'll edit the video to add any more information. But basically, all new referrals come through the partnership panel, and if they're referred to Young Hackney, they're referred to a specific unit. Now, there's some core units who deal with adolescents. There's also the primary units, which are primary school-aged children, including the reintegration unit, which is a short-term work unit for young people at risk of exclusion from school. Family units, which deal with more complex families, the gangs unit, which does what it says on the tin, and the triage unit. And the way Young Hackney works, it kind of mirrors the reclaiming social work model. So each Young Hackney unit has a core leader, which is the equivalent of the consultant social worker, and then another 2 or 3 workers and practitioners. And each unit also has a CAMS for Young Hackney clinician. And the role of the CAMS for Young Hackney clinician, it's quite varied. In many ways, it's not that different from what core CAMS offer. We offer assessments to young people with mental health needs, interventions, we have specialist assessments like neuropsych clinic, MDT CAMS team. But the thing that makes it a little bit different is the way that the units work, is that the unit oversees all of the cases within each unit, so we all have responsibility. So we sit in the unit meeting and just provide a bit of a CAMS ear. So listen to the cases being discussed, ask some questions from a mental health perspective, hopefully add something to the unit that might not have been there if we weren't there really.
And the other thing about CAMS for Young Hackney is that we're actually a multidisciplinary team. So within the team we have psychologists, family therapists, mental health social workers, psychotherapists, clinical nurses. Social workers.
Oh, did you?
And we also have input from a psychiatrist, and I think that makes us quite a unique team because we are a multidisciplinary team and we work in a particular way in the community.
So I suppose kind of as you're listening, you're probably thinking, well, it's nothing that our team don't do, but I think it's not necessarily what we do, but the way our service is set up, we have an opportunity maybe to do it a little bit differently.
So we'll speak fast. So the way that we work on an outreach model, so it's the flexibility of staff in terms of we offer out of hours appointments, so if families are working and they need to see us out of hours, then we're flexible to see them. We also see parents at work, and sometimes that might mean that we travel out of the borough. We offer early appointments, and I think the main thing about this is the location. So we see young people wherever they feel comfortable. That might be in the family home, that might be in the youth club, that might be in McDonald's. So we're happy to go with wherever young people feel comfortable, and we're about joint working. So we work jointly with Young Hackney, so we don't take the cases and work them on our own in isolations. We work within a unit, so that means each of us in that unit has a particular role. So we work very well with Young Hackney together, and I think the main thing that I would say is the passion for the model. You have to have a passion, the staff have to have a passion for working in this particular way, because it does have its challenges.
I think as well it's probably worth saying at this point that we're not really able to run a waiting list, because it feels like we have a really small window of opportunity when our Young Hackney workers kind of say, right, we've finally got this person to see someone from CAMS, we need to be quite reactive to that and be able to meet the person as quickly as possible.
So that's our outreach model. So that includes everybody. It includes the young person, partnership agencies, family, schools, communities, youth hubs, and statutory and voluntary agencies. So we see young people that are statutory orders. We make sure that we follow them through whether they're in the community, whether they've been remanded in custody, and back out into the community. So we provide a continuity of care that I think is really important in this kind of group.
I'm trying to beat 7 minutes now, so go really fast. So one of the key things, obviously central to IAPT, is the people participation. And our aim really is to engage and support all service users, particularly those that traditionally probably don't involve themselves in activities like this. So at the minute we've got things around recruitment of staff, so training young people up to be on the interview panels when recruiting staff, creating emotional health and wellbeing boards at the hubs, and that's really just getting people talking about mental health and kind of getting it on the agenda again. Reviewing team materials like our leaflets, hopefully with the aim of making them more engaging and people more likely to see us, and training people on the WhatsApp website. And this, I mean, the ROMs that we use in outcome in IAPT have been, I think, really, really useful, because it's a set of people that just don't routinely engage in services, so it's really hard to kind of get their feedback. And it's been quite exciting. It's been a way to find out perhaps why people haven't engaged before, what's keeping them engaged this time, and it's been a really difficult balance, because it's about keeping them engaged, so using the routine outcome monitoring in a sensitive way, but also kind of doing something with it. And I think historically as a service, and I know a few people have mentioned it today, particularly with calls and things like that, we haven't done a great deal with the outcomes that we get. So this for us is a lovely opportunity to really show the young person that their feedback means something, and it's going to change the way we offer them a service if that's what they want.
Yeah, I think one of the things that we want to do is to make sure that young people have a really good experience of the CAMS service. So whether we have a brief engagement with a young person, whether it's one session or whether it's 3, we hope that they take away that actually coming to a CAMS service is not that bad, and we challenge some of their views about mental health or emotional health. Thank you.